morning, grade 9. Technology and Livelihood Education, Quarter 3, Caregiving. The objective of these lessons are: number 1, define caregiving. Number 2, enumerate the kinds of wounds. Number 3, give the procedure in controlling infections. Number 4, describe the two methods of applying a dressing. Number 5, identify the types of dressing and its applications. Number 6, identify the type of bandage. And number 7, describe the types of open wounds. Our lesson is all about implementing and monitoring infections. Have you experienced treating an injured person, a younger brother or sister while playing, or have you seen a doctor, a nurse treat wounded patients? In this lesson, you will learn about different wounds and how to treat and take care of them. What is caregiving? Caregiving is the act of looking after individuals, helping them to do what they would do by themselves if they could, and helping them if they can no longer move or do things for themselves. Regardless of age, the primary objective of caregiving is to help a patient become as independent as health permits. A patient can be anyone suffering from injury or illness and requiring care. He or she could be a child or an adult who is recuperating from surgery, or an elderly person who requires a long-term care. What are the kinds of wounds? Wounds, whether a large or small, can be infected. If infections start, there can be some damage to the body. Prevention is the best way to avoid this problem. An open wound is a break in the skin which is the result of an injury or an operation and in which bleeding can be seen. A closed wound is a bruise or contusion that results when a blunt or hard object strikes the body. No blood can be seen on the skin surface because the skin is not broken. What can be seen is discoloration, swelling, and pain. Wounds need special treatment. This depends on their size and how severe they are. Professional help is needed if the injury is large and severe, and if the patient already has fever. He or she has to stay in bed, at home, or in the hospital for some days. Injuries, whether large or small, should be cared for the same way to prevent bacteria from entering the body that may cause infections to achieve fast healing. Procedure in controlling infection. A caregiver or a person attending to an injured person or patient should know how to recognize and treat an infected wound. Usually, wounds that are infected are swelling and become red. It may develop pain and pus discharge. The person with an infected wound may also develop fever and swelling of the lymph node. The area of the wound must be clean, washed, and covered with a dressing. The dressing should be good enough to prevent bacteria in entering the wound. It should be porous to allow sweat to evaporate. Otherwise, the skin will become moist and bacteria will increase in number. The best way to prevent infection is to eliminate bacteria that may come contact with the patient by: number 1, sterilizing equipment. Bacteria can be destroyed by boiling, pyrogenation, chemical disinfection, or steam under pressure. After this procedure, when the bacteria had been destroyed, the equipment can now be used safely. Nowadays, Pre-packed sterilized dressing can be brought from drugstore and hospital equipment and supplies manufacturers. This equipment and supplies must remain sterilized until the seal is broken or damaged. Sterilized equipment and dressing needed to perform a medical procedure or address wound must be packed and sealed together and must be ready for use at any time. After use, they are wrapped and properly disposed. There are also some items that are packed and sterilized in the central supply department of a hospital that are too expensive to be thrown away, like metal and plastic, jugs, bowl, and glass syringe. After use, they are packed and returned to the department where they are cleaned, repacked, and sterilized for another use. Another one is using an antiseptic technique when applying dressing. A caregiver should observe some precautions whenever dressing a wound to avoid contamination from microorganisms. If the room is to be cleaned, dust the room at least 1 hour before applying the dressing to allow airtime to settle. Clean the trays to be used with the soap and water and see to it the sterilized packets are not damaged. Wash your hands before you start the dressing. Avoid too much talking during the procedure to keep the microorganism you breathe out from the nose and mouth to a minimum. Applying dressing depends on the size and the positions of the wound and what equipment is available for use. Usually in the home, a small wound, cut, or burn is to be treated within a minimum equipment necessary. In case of a larger wounds, the caregiver has to assist the doctor or nurse who will provide larger dressing and the necessary sterile equipment in the dressing wound. Treat an infected wound by number 1, keeping the area clean. Number 2, soaking it in warm water or applying a warm pack over it. Number 3, elevating the infected part. Number 4, applying antibiotic ointment on the infected part. Number 5, changing dressing daily. And number 6, seeking medical help if the infections persist or become worse. Dressing. A dressing touches and covers an open wound. Whenever possible, a dressing should be number 1, sterilized. If sterilized dressing is not available, use a clean cloth, handkerchief, wash, cloth, and towel. Number 2, larger than the wound. Number 3, thick soap and compressible so that the pressure is evenly distributed over the wound. And number 4, lean-free. Purposes of dressing. Number 1, control bleeding. Number 2, prevent infections and contaminations. Number 3, absorb blood and wound drainage. And number 4, protect wound from the further injury. Some don'ts in using dressings. Number 1, do not use a fluffy cotton or cotton balls as dressing. Cotton fibers can get in the wound and can be difficult to remove. Number 2, do not remove a blood-soaked dressing until the bleeding stops. If necessary, cover with a new dressing. Number 3, do not pull off a dressing stuck to a wound. If it needs to remove, soak it off with warm water. What are the type of dressings? Number 1 is gauze pads. They are used for small wounds. They come in separately wrapped package of various sizes and are sterilized unless the package is broken. Some have a special coating to keep them from sticking to the wound. These are especially helpful for burns or wounds secreting fluids. Number 2, adhesive strip. Example is Band-Aid. These are used for small cuts and abrasions and are combinations of both a sterilized dressing, and a bandage. Number 3, trauma dressing. These are made of large, thick, absorbent, and sterilized materials, individually wrapped. Sanitary napkin can serve as a dressing because of the bulk and absorbency, but they are usually not sterilized. Number 4, improvised dressing. When commercial sterilized dressings are not available, an improvised one should be as clean, absorbent soap, and pre-ob lint as possible, a handkerchief or a towel. Sterilize a cloth bath by boiling it to dry, by ironing it by several minutes, or soaking it in rubbing alcohol and allowing it to dry. Applying a sterilized dressing. Number 1, if possible, wash your hands. Number 2, use a dressing large enough to extend beyond the wound's edges. Hold the dressing by the corner. Place the dressing directly over the wound and do not slide it on. Number 3, cover the dressing with a bandage. Number 4, do not touch any part of the wound or any part of the dressing that will be in contact with the wound. Number 5, do not cup, breath, or talk over the wound or dressing. Bandages. A bandage should be clean but not sterilized. It can be used to, number 1, hold the dressing in a place over an open wound. Number 2, apply direct pressure over the dressing to control bleeding. Number 3, prevent or reduce swelling and provide support and stability for an extremity or joint. Types of bandages. Number 1 is roller bandage. A roller bandages come in various widths, lengths, and type of materials. 1 inch width for finger, 2-inch width for wrist, hands, and feet, 3-inch width for ankles, elbows, arms, and 4-inch width used for knees and legs. Number 2, self-adhering. Conforming bandage. This comes as a roll of slightly elastic, gauze-like material. They come in various widths. The self-adherent quality make it easy to use. Number 3, gauze roller bandage. These are cotton, rigid, and non-elastic. They come in various weighted 1, 2, and 3 inches and are usually 10 yards long. Elastic bandage. This is used for compression bandage for sprain, strains, and contusions. They come in various widths. They are not usually applied over dressing covering wound. Number 5, improvised bandage. When commercial roller bandage are not available, you can use a belt, necktie, or torn strip of cloth from a sheet or other similar material as a substitute for commercial roller bandage. Number 6, triangular bandage. Triangular bandages are available commercially or can be made from a 3 to 40 inches square or press-shrunk cotton muslin material that is cut diagonally from corner to corner to produce 2 triangular pieces of cloth. The longest side is called the base. The comber directly across from the base is the point and the other 2 combers. Hazard and outcome of infections risk assessment. Number 1, infections may cause swelling of the wound and becoming red. Number 2, it may give off sensation of hurt and develop pain and pus discharge. Number 3, it may develop fever and swelling of lymph nodes. Number 4, it may develop 1 or more red streak leading from the wound toward the heart. And number 5, if the infection has reached the circulatory system, it is known as blood poisoning and the patient will experience chills and fever. Factors that contribute to a wound infection. Number 1, dirty and foreign materials left on the wounds. Number 2, rub on crushed tissue. Number 3, injury to underlying bone, joint, or tendon. Number 4, bite wounds from a human or animal. And number 5, puncture wounds or other wounds that cannot be drained. Types of open wounds. Number 1, abrasion. It is a scraping or scratch on the skin resulting in partial loss of the skin surface. It has a little bleeding, and the common cause is rubbing or scraping. If it covers a large area, it can be painful and serious, especially when a foreign object is embedded in a large area. It can be painful and serious, especially when a foreign object is embedded in it. Number 2, incision. It is a skin wound or cut with a smooth edges and can have a severe bleeding. The usual cause of the injury is contact with a sharp object. Number 3, laceration. It is skin wound with uneven edges. The usual cause is contact with a blunt object tearing the skin. It can have several bleeding because veins and arteries can be affected and there is a danger of infection. Number 4 is puncture. If a wound which is narrow and deep and can reach into vein and arteries, the entrance is usually small, like a stab wound from pointed object. If the object is embedded in the wound, the risk of infection is high. Number 5, avulsion. It is a partial tearing of patch of skin or other tissue, and torn off tissue is length hanging. Most often, it involves ear, fingers, and hands. Number 6, amputation. It involves the cutting or tearing of a body part such as a finger, toes, hands, feet, arms, or legs. What to do in dealing with an open wound? Number 1, wear disposable latex gloves if not available. Use several layers of gauze pads, plastic wraps, or bags. Bare hands should not be used and it is also a resort. Number 2, to see where the blood is coming from, remove or cut the clothes of the patients and expose the wounds. Number 3, to control bleeding, apply direct pressure with the fingers of the palm. Place a sterilized gauze pad or clean cloth over the entire wound. Elevation may be used in combination with direct pressure to stop further bleeding. Procedure in cleaning open wounds. So number 1, before cleaning an open wound, wash your hands with soap and water. Wash them with a vigorous scrubbing action. Dry them and wear disposable plastic gloves. Number 2, for a shallow wound, wash it with soap and water. Irrigate it with clean enough to drink water for an adequate wound cleaning. Number 3, for a wound with high-risk infection like a larger wounds or extremely dirt wound, seek medical care for wound cleaning. If you are in a remote area, clean it well and apply betadine 10 preparation solution, then seek medical attention. Number 4, remove with a sterilite tweezer the small objects not flushed out by irrigation. A wound, if not clean, will leave scars on the victim's skin. Number 5, cover the wound with a non-stick sterilite dressing. For a shallow wound, an antibiotic ointment can be applied. And number 6, change the dressing daily and move often if it gets wet and dirty. Some don'ts in a cleaning wound. Number 1, do not irrigate a wound with a full-strength iodine preparation like 10 betadine or 70 isopropyl alcohol. It kills both body cells and bacteria. Number 2, do not use antibiotic ointment on wound requiring stitches or on the other wounds where drainage may be prevented. Number 3, do not breathe or blow on the wounds or dressing. Number 4, do not close the wound with butterfly tape or stem stripe because when bacteria are entrapped, in the wound, infection is more likely to be happen. And number 5, do not use hydrogen peroxide because it does not kill bacteria. Initial procedure in treating closed wound. A closed wound is a bruise or contusion resulting from a blunt object that hit a body part. Apply, number 1, apply an ice pack on the bruised area for 20 minutes. Number 2, apply an elastic bandage with a pad if an arm or leg is involved. Number 3, the victim must be examined for possible fractures. Number 4, to lessen the pain and swelling, the injured part should be kept above the victim heart level. And number 5, seek medical help if you suspect an internal bleeding, broken bones, and bruises that show up for no apparent reason. Monitoring infection control performance in implementing improvements in practice. To monitor the effects of controlling infection, the caregiver has to fill out the patient's personal record. All the necessary data have to be recorded accurately and promptly. Diagnosis and decisions of the attending physicians depend on the information provided by the caregiver. The record includes the following. Number 1, name of patient. Number 2, age, sex, and address. Number 3, clinical history of the patient. Number 4, temperature, pulse rate, and blood pressure. Number 5, doctor's order sheet that indicates the standing order of the attending physicians and the prescribed diet. Number 6, therapeutic sheet records the medicines prescribed and the kind of treatment rendered. Number 7, an observation sheet that records the reactions to the medicines the patients had taken. The caregiver has to record the conditions of the patient from time to time. Maintaining a record will help the caregiver monitor the conditions of the patients and improve whatever procedure is necessary. The caregiver has to record the physical and emotional health conditions of the patient. This will help the attending physicians evaluate and diagnose the ailment of the patient. The patient is assured of proper care, and his or her recovery depends greatly on how well he or she is taken care of. This is possible when the caregiver is dependable and reliable. Number 1, today, there is a growing awareness of equipping family members with basic knowledge, skills, and competencies in caregiving. Number 2, it is high time for school to provide scientific information to high school students with the fundamentals of caregiving. Number 3, caregiving is the act of looking after an individual, helping him or her to do what he or she can do by himself or herself if he or she could, and helping him or when he or she can no longer move or do things by himself or herself. Number 4, wounds, whether a large or small, can be infected. Prevention is the best way to avoid this problem. And number 5, the best way to prevent infection is to eliminate bacteria that come in contact with the patient by sterilizing equipment and using an antiseptic technique. The type of open wounds are abrasion, incision, laceration, puncture, avulsion, and amputation. And number 7, maintaining a record will help the caregiver monitor the conditions of the patient. This is Evelyn B. Sagana. Thank you for watching.